You're getting to an area that I think has an impact that the public's not generally aware of, but I refer to it as the 2T effect, technology and tort reform. Let's use your description of the MRI. When the MRI technology became available to us in the field, then people said, I want to have access to that when I need to have access to it for the patient's best interest. But because it was such good technology, it almost became a tool to be used to rule out whether there was something there or not necessarily to diagnose what was. And because of the tort system, the legal system, saying that, doctor, you have a duty to perform to the highest level of care, and if you don't, you're going to be held accountable, and the institution's going to be held accountable, then people started to order them more frequently.
I actually went to law school with the hopes of maybe ascending into hospital administration. In my medical practice, and I know this is true with other practitioners, every time they see a patient, they're in essence doing two things. They're trying to reach a diagnosis, and they're trying to care for the patient, but they're also trying to build a case, their own defense case, in case something happens. Because what actually happens now is that any bad outcome, the patient now becomes a plaintiff, is looking for someone to pay for it. The idea is that every problem is fixable. You should have fixed it. If it wasn't fixed, there's something wrong, and I should be able to sue you for that. And as a result, we order test after test after test. We do everything possible because in the backs of our minds, we say, I can hear that plaintiff's attorney saying, and doctor, why didn't you order this CT scan of the abdomen?
It's actually dangerous to patients. We now know that because of the number of CT scans being done, that probably somewhere in the neighborhood of 2% of the fatal cancers in the next 10 or 15 years will be as a result of excessive use of CAT scanners.
So we order all those tests, not because we think they're going to produce anything, but because we're afraid that if something terrible happens, we'll be criticized for it. So am I part of the problem? Yeah, sure I'm part of the problem, because I'm afraid of being sued.
We estimate that to be 10 to 15% of unnecessary medical care delivered to patients purely from the physician's fear of a malpractice situation.
There are places right here in Oregon where you cannot get obstetrical care because of the medical malpractice. These obstetricians are dropping that part of their practice and just practicing gynecology, and that's also a real problem. So any system, I think, has to address that question. Now, our counter-argument to dealing with medical malpractice is people need access to justice, and I don't disagree with that. I don't think they're mutually exclusive. But there's a lot of ways people lose access to justice today. One of them is a system that forces you to have a stroke before we'll manage your hypertension. So we need to step back and put all of this into context and recognize that what we have doesn't work for anyone.